Hello everyone, welcome back to the channel. My name is Dr. Rosa, you can call me Dr. Rose, and today we're going to be talking about the new pandemic, the coronavirus. So before we dive into this video, I want to let you know that this video is being recorded on March 4th, 2020, and this is important because all the information that I will provide to you in this video is valid and updated up until this date. And as we know more about this novel virus, then I will update you accordingly. So as a doctor, I've been constantly asked about different aspects of the coronavirus by friends, family, patients, and although some of the information that's out there is true, there is still a lot of unfounded, untrue, and misleading information about this new virus. As such, I decided to make this video to give you accurate information and shatter some of the myths that are kind of floating around out there. First off, the coronavirus refers to a family of viruses that can infect some humans and some can infect animals. For humans, some of these viruses are responsible for causing something known as the common cold. Others may cause severe respiratory infections that in occasions can be fatal, just like the SARS and the MERS back in 2002 and 2012. The official name of this novel virus that's making headlines is the SARS-CoV-2. SARS standing for Severe Acute Respiratory Syndrome and CoV standing for coronavirus. And as such, it is incorrect to call it the Wuhan virus, the Chinese virus, or the bad virus. Now, this virus causes something that you've probably heard of called COVID-19. COVID-19 stands for Coronavirus Disease 2019. And to be able to understand this distinction, we can compare it to the HIV and AIDS. HIV is the specific virus and AIDS refers to the disease this virus causes. And so SARS-CoV-2 is the specific virus and COVID-19 is known as the disease that this virus causes. Which brings me to my first myth, that the coronavirus and the HIV virus are essentially the same. This statement is false because the coronavirus and the HIV virus are two different viruses that work in different ways. The confusion lies in the way that the viruses carry and transport the information. Viruses are composed of genetic material that can be carried and transmitted in different ways. And although the HIV virus and the coronavirus carry the genetic information in the same manner, the genetic information itself and the way they transmit this information to cause disease is essentially different, which then is the second myth. So I've been asked that the coronavirus is an epidemic and that it is a pandemic. So what's the difference and which one is it? So an epidemic is a sudden increase in a certain disease within the population in a specific geographical area. In other words, the coronavirus was declared an epidemic when there became a lot of the same cases within the Wuhan region and even within China. However, since then, the virus has spread to multiple different countries and around 80 or so countries have reported cases of the coronavirus. And as such, when it spreads to different countries, it is classified as a pandemic. Which comes to the next myth, in which the coronavirus and the flu have the exact same symptoms, so how do they distinguish it? It is true that the coronavirus and the influenza or the flu share some of similar symptoms, such as cough and fever. Unlike the flu, the coronavirus can also cause shortness of breath or difficulty breathing. Meanwhile, the flu can also present with sore throat, stuffy or runny nose, headaches, tiredness, body aches, and in some severe cases, nausea and vomiting. Also, symptoms for the coronavirus after being exposed can present or can appear anywhere between 2 and 14 days. Whereas the influenza, these symptoms can appear anywhere from 2 to 4 days after being exposed. This period is called the incubation period. Since these two can sometimes be difficult to distinguish, the best recommendation that we can give as thus far is to get vaccinated against the flu. This will also help to reduce the chances of getting the flu and have a weak immune system in the face of a new virus threat, in which people start to consider what can we do to prevent it. And around this has evolved a lot of different myths. The first myth is that wearing a face mask will prevent you from getting infected. This statement is false. Both the CDC and the WHO have given public statements regarding this. Face masks especially those that are loose-fitting, do not protect you against inhaling the particles through which the virus spreads. In fact, it can theoretically increase the risk of infection because you would constantly be breathing in and out the particles that may get stuck inside your mask. For this reason, the recommendation is that face masks should only be worn by those people exhibiting symptoms or diagnosed with a coronavirus infection. If you don't have any symptoms, I encourage the general population to not buy masks out of the mere panic and overuse and unnecessary use by the general public. This is because due to the national shortage that there is because of this excessive consumption of masks by the general public, the healthcare providers, anywhere from nurses to physicians and everyone else involved in direct patient care, do not have masks to be able to protect themselves against the patients that they see every day. Another myth is that people have heard of natural ways or natural remedies or supplements that may either cure or prevent them from getting infected, and I've gotten asked if they actually work. In short, the answer is no. I've seen many outlets and many people spreading misinformation about products or supplements that help either prevention or help increase the immune system, among other false claims. Some of these are: keep yourself hydrated to prevent infection. While it is always recommended to have good fluid intake and drink lots of water to prevent dehydration, especially when battling an infection, it is not true that drinking constant sips amount of water will prevent infection with the coronavirus. Another false claim is that garlic will help cure the coronavirus. There is absolutely no evidence thus far that eating garlic will help prevent coronavirus infection or even cure it. Another claim is that gargling or drinking bleach will help prevent infection or cure if you're infected. Multiple agencies, including the FDA, have warned against drinking any sort of bleach products. Not only because there's no evidence to support the fact that drinking bleach products will decrease the chances of getting infected or even kill the virus if you are already infected, but also it's because drinking bleach products may cause severe damage to your health and can even sometimes prove fatal. Another claim is that silver products will help cure the infection because it will boost the immune system. Please do not fall into these scams. There is absolutely no evidence that silver-based products will help prevent infection, kill the virus, or even have any sort of health benefits. These nor any other supplement has any evidence to back up the claim that it will boost your immune system. So the next question I've gotten very commonly is, what can I do to prevent getting infected? The coronavirus spreads from person to person by either direct contact, for example, a handshake, or by respiratory droplets whenever someone coughs or sneezes. It can also spread by touching surfaces or objects that have been infected with the coronavirus and then touching your mouth, your eyes, or your nose with those same hands afterwards. As such, the CDC has published some universal preventive measures. Avoid close contact with people who are sick. Avoid touching your mouth, nose, or eyes, and if you have to, wash your hands first. If you're sick, stay home. Use a tissue to cover your mouth and nose if you're going to sneeze or cough. Afterwards, throw the tissue away in the trash and wash your hands. Frequently clean and disinfect surfaces and objects, especially public ones, before getting in contact with regular household products. For example, Lysol wipes or Clorox wipes will do. Only wear a face mask if you are sick to prevent spreading the disease to others. Wash your hands with soap and water at least for 20 seconds, especially before eating, using the restroom, or if they're visibly dirty. And if soap and water isn't available, use hand sanitizer that's at least 60% alcohol. The other question I've seen often is, I got infected, am I going to die? No, getting infected does not mean that you signed your death sentence and you're going to die. In fact, a recent study published in the New England Journal on February 28, 2020 showed that the mortality rate originally was at 2%, however, it now has decreased to 1.4%, and they suspect it may be even lower. Another study showed that around 80% of the cases diagnosed are mild and do not require hospitalization or don't even show any symptoms. Only about 16% of the cases have been hospitalized and required ICU care. The population most at risk are elderly people, people with underlying heart conditions, lung conditions, or diabetes, and the immunocompromised. Another question I've been asked is, I ordered packages from China. Are they safe? The answer is yes, they are safe. Studies have shown, and the World Health Organization and the WHO has concluded that people receiving packages from China are not at risk to contract the virus. This is because the coronavirus in general does not survive well on objects or surfaces for a long time. And the last question I've gotten, I think I'm infected. What should I do? If you have symptoms similar to those to the flu or the common cold, please go seek medical attention with your primary care provider. It is very important that you get evaluated by a doctor and have an accurate diagnosis and be managed promptly. Finally, I've gotten the question that people have heard that there are some treatments available, and if this is true. Although more than 80 clinical trials are being done to find a specific treatment for the new virus, even those that use HIV medications as a way to treat it, no clinical trials have given any specific results. As such, only supportive treatment is given. In other words, treating the symptoms and allowing to let your body fight it out. In the meantime, a vaccine is in development. However, it is estimated that it will take at least 12 to 18 additional months until this vaccine is available to the public. So this is all for this video. If you have any questions or comments, please leave them in the comments section down below. If you like this video, please like and subscribe. It means a lot. In the meantime, I'll keep you updated with anything else I can find. And until then, I wish you a happy and healthy life.